Hi, this is Anchor Shivani Gupta. I am today at India's most prestigious event, Anicon 2022, in the city of Joy, Kolkata, and with me I have.
Dr. Kaushik. I am a consultant pediatric neurosurgeon working in this city.
And sir, here we at TIPCA, we are bringing awareness about winning over epilepsy, how to overcome epilepsy. So sir, my question to you is, how far do you think that epilepsy is occurring more because of the unawareness in the society in India mostly?
See, for my age group of patients who are cater to pediatric age group, there is a lot of lack of awareness. As you know, especially the young mothers could not identify the symptoms of epilepsy in a neonate. So what happens, neonates and children are having seizures. Not always that they are very overt. Many a times they are subclinical or there are very mild symptoms like a tweaking of eyeball or a subtle deviation of the face, which the mother fails to understand. But the epilepsy is going on inside and it is causing damage to the developing brain. So that's why we require this awareness.
Right, sir. And can you just tell us the few things where we can actually diagnose that the person is going to, the person is going through epilepsy in an early stage? If you can just tell us something, within few pointers, that these are the causes of epilepsy. This can be one of the causes of epilepsy. The symptoms, yes, sir.
What happens when a child gets an epilepsy? He gets unrelated to the environment. That is the first thing that the parents should notice. That a child who was smiling or talking or doing some activity suddenly becomes still. Number one. In overt cases, there is an abnormal movement of the eyeball. There is an abnormal movement of the upper and lower limbs. There is also some some shrill cry. That is not a normal cry, not a cry for hunger, but a sharp pitch cry, which itself suggests there is an epilepsy. In some cases, there may be some loss of consciousness, usually in older children, like 7 years, 8 years, and like this.
All right, sir. And you are practicing, from so long. What is the most common myth which you have come across till now? The most common ones which, you have always seen that, सब यही बातें करते हैं.
See, the epilepsy is being still in the villages, in the rural community. Epilepsy is given a stigma. See, if you have an epilepsy, you are some sort of outcast or so. And in the cities, what I have seen, even in epilepsy, even in adults, people are putting spoon in the mouth, taking shoes so that they can smell the shoes, and all sort of these so-called therapies. Actually, the first few minutes of how to manage epilepsy is absolutely vital, and there's a lot of lack of awareness about this.
And sir, how do you think that we can create awareness?
It's only by educating people, by going to the people, educating them, doing TV ads, and showing in media, prints, and all, and most of all, involving the people in non-medical gathering also, spreading the awareness of epilepsy.
Right, sir. And I would like to know a small message for all the patients who are already suffering from epilepsy.
For those who are suffering from epilepsy, the first thing is that it is not a disease. It is a symptoms of a disease, or in majority of the cases, it is just an electrical abnormality of the brain, like an electrical short circuit, which we have in our home, which we possibly can have at our home. So this is an aberration, which can easily be treated and fully cured with medicines.
Right, as
you may require 2 medicines, 3 medicines, whatever, but in every type of epilepsy, except a very minute numbers, can be cured with medicines only.
as rightly said by sir, this can be cured by medicines, and if you are taking help of your doctors, you can overcome this illness as well. Right, sir? Thank you so much for joining it.